Hello and welcome. Very good morning. You're watching Mirror Now. I am Afrida Rahman Ali. Let's begin by giving you the latest updates coming in from the Health Ministry with regards to the standard operating procedure that has kicked in from today as the country decides to open up shops, restaurants, offices, and also religious places. So we are going to take you through the detailed SOP for each of these categories. Let's begin with offices first. Now, when we talk about opening of workplaces, there are many concerns since there are shared spaces. So what the government has decided is to release a set of guidelines for all the offices to follow. And what has been decided really is that for shared spaces like workstations, corridors, elevators and stairs, cafeteria and meeting rooms, there will be all of this will be mostly in closed settings which will be monitored constantly. So specific SOP has been set up to maintain distancing in office premises, which we will be running for you on your screens right now. There are, of course, certain mandatory provisions that are to be made, like sanitizer dispenser, thermal screening, and also in terms of entry of people into the office, there will be a stringent screening at the entry level as well. So some of those SOPs are there for you to see on your screens. Also, we are going to give you the detailed SOP for the shopping malls. So restricting number of people at shopping malls is the major challenge so that the footfall is staggered and there is no overcrowding. So the SOP for shopping malls actually completely focuses on that point of staggering or rather minimizing crowds. Ayushmann, my colleague, is joining us now to give us details on the SOP and the protocols that have been set up. Now, this is extremely important because as we open up, the responsibility lies with every individual to follow these guidelines. Ayushmann, first we are focusing on offices and shopping malls. Can you take us through the SOPs, please?
Well, Afrida, first of all, the health ministry issued the guidelines, like you mentioned, and a few things were common for every place, like the congregation of people, large number of people getting together at one place is not allowed. The face mask remains a compulsion. The entrance point of office, religious place, and also shopping malls. At that place, the hand sanitizers will be given, and people who are asymptomatic, they should only be there in the premise. Also, Afrida, it has been clearly said that in the offices, if you see, like it was earlier pointed out, that if one or two person gets COVID infected, not entire office has to be closed. But if the cluster grows up there, if large number of cases start getting reported from there, somewhere the need will be arising. At the same time, Afrida, we heard about in past few months, we heard about the work from home concept. Now, the offices have been allowed to operate with 100% attendance somewhere. And in the guideline which has been issued to the offices, the people who are above the age of
Right.
in the senior category, they have been told that if they are facing some kind of problem or they can work from home, that should be better. And also staggered timing should also be there. And the sanitization of the lavatories and also the staircases and the office premises is very much essential.
Okay. Right. So, Ayushmann, those are the two categories that you have specified for us, the guidelines that are in place. Let's now also shift to the other two categories. Stay with us, Ayushmann. For the restaurants, again, a detailed guideline has been released. Now, this again has got to do a lot with the hygiene standards that have to be maintained and the focus on home delivery. Despite dine-in being allowed, home delivery is in fact advised for restaurants. Similarly, for hotel and hospitality business, record keeping and certain screening processes have been detailed. All hotels and hospitality units have been told to take suitable measures to restrict the spread of COVID-19 by following stringent measures in their premises. The SOP says all possible physical contact between the staff and the guests are to be minimized. But I'll again go across to Ayushmann, who has access to this particular release from the Health Ministry. Ayushmann, for restaurants and for those catering to the hospitality business, what are the guidelines released?
Frida, clearly the restaurants have been told that the dining facility is now allowed. The the sitting capacity in the restaurant must be restricted to 50% of what the capacity is there. The disposable menu and paper napkins have also been advised, and it has also been said that if possible, the separate exit and entry point for staff, patrons, as well as people who are in the supply business, that should be there. And all the people who are serving the food to people, to the customers who are coming, they must have face mask with them. And every time a person eats a food and he leaves, after that, proper cleanliness should be ensured on that table. This is for the restaurant. On the hotel part, Afrida, it has been clearly said that the hotels need to adopt a contactless process like QR code, online form, and digital payment at the time of check-in and check-out, and the guests will have to provide their travel history and medical condition. That means that somewhere at the hotels also we will see that they will be demanding your medical certificate or with an ID or a self-declaration form. The guest luggages which we take in the hotel of Afrida, that has to be sanitized or disinfected before that is being sent to the rooms. And the room service and the takeaways are encouraged. Just the room service and the takeaways are encouraged. The dining in the areas in the hotels, is it has been said, it should be avoided.
All right, so those are measures announced for hotels and restaurants. Stay with us, Ayushmann. The third and the last category that we are focusing on today are the religious places. So there are again guidelines because temples, mosques and other places of worship are allowed to open outside containment zones. But let's not forget that there are tendencies for people to congregate and engage in bhajans or singing, which is being prohibited, by the way, because this is an infection that can spread from person to person while speaking or singing. So that is one of the things mentioned in the SOP for religious places. I want to go across to Ayushmann once again. Ayushmann, besides social distancing and other obvious measures, certain specific points have been mentioned in the SOP for religious places.
Yes, Afrida. In fact, the religious places which are outside the containment zones only, they will be allowed to open. And we normally see the elderly people going to the temples, but here temples or mosques. But here it has been clearly said that person above 65 years of age, person with comorbid conditions, and pregnant women and children with below the age of 10 are advised to stay at home. Now, it has also been said that the entrance should be sanitized properly, and thermal screening at the religious places should also take place. Footwear, if you can put in the vehicle, that is also important, and a separate slot has to be there. And also, Frida, it has been said that the bhajans which we hear normally the devotees do, that should not be there. The touching of idol is also not allowed. It has been said that all those people who are visiting the religious places, they must bring their own mats, and somewhere the congregation to a large extent should be avoided.
Okay, Ayushmann, we leave it at that for now. Thanks very much for giving us a detailed understanding of the protocols that have to be followed under these three categories of malls, markets, shops, restaurants and hotels, office spaces and religious spaces. Thanks, Ayushmann, for giving us all the information.